Have you ever wondered what happens to your body when you don't sleep for a week? Well, the consequences can be severe and potentially life-threatening, impacting both your physical and mental health. At the top of the list, we have impaired cognitive function. A lack of sleep leads to significant impairments in this area, with issues arising in memory, attention, concentration, and decision-making. As a result, you may struggle with processing information, solving problems, and retaining new information. Next, we delve into mood changes. Sleep deprivation can trigger significant mood disturbances, including irritability, mood swings, anxiety, and depression. Essentially, you become more emotionally reactive and less able to deal with stress. Things can get even more serious with hallucinations and delusions. Prolonged sleep deprivation can cause you to see or hear things that aren't there and cling on to false beliefs. These symptoms can be distressing and can further impair cognitive function and reality testing. Physical fatigue is another consequence of sleep deprivation. You may feel physically drained and find it challenging to perform even simple tasks. Moreover, your immune function weakens when you don't get enough sleep. This makes you more susceptible to infections and illnesses as your body's ability to fight off pathogens reduces, increasing the risk of catching colds, flu, and other infections. Chronic sleep deprivation could also increase your risk of various chronic health conditions, including obesity, diabetes, heart disease, and hypertension. This is because prolonged sleep deprivation can disrupt hormonal systems involved in metabolism, appetite regulation, and cardiovascular health. Motor function isn't spared either. Sleep deprivation can impair your motor coordination and reaction times, making you more prone to accidents and injuries, particularly while driving or operating machinery. Hormonal imbalances are another consequence of sleep deprivation. This can lead to alterations in hormone levels such as cortisol, the stress hormone, and growth hormone. These hormonal changes can have wide-ranging effects on metabolism, immune function, and overall health. In extreme cases of sleep deprivation, your brain may experience brief episodes of involuntary microsleeps. These are moments where you fall asleep for a few seconds or minutes without realizing it. These microsleeps can occur spontaneously and increase the risk of accidents, especially in situations requiring sustained attention. Finally, prolonged sleep deprivation can exacerbate or trigger psychiatric symptoms in susceptible individuals. These could include psychosis, mania, and suicidal thoughts. Sleep deprivation is often used experimentally to induce temporary psychotic symptoms. In conclusion, not sleeping for a week can have profound and detrimental effects on your physical, cognitive, and emotional functioning. It's crucial to prioritize sleep and seek professional help if you're experiencing persistent sleep disturbances or insomnia. Remember, your health should always come first.